Hello everyone, my name is Luis Ramirez and today I will be presenting my current event presentation. For my current event, I have decided to do research on how the COVID-19 pandemic has affected Latinx communities when compared with other races. I will begin by giving a brief introduction about the topic. The COVID-19 pandemic is an ongoing global pandemic that has affected many people from all around the world. As of March 1, 2022, the pandemic has been responsible for more than 437 million cases and 5.95 million deaths, which makes it one of the deadliest in history. According to an analysis by IHME, Hispanic and Latino Americans are more likely to die from COVID-19 than non-Hispanic white Americans. This is definitely a problem because no race should be more susceptible to a disease than another race, and it makes you wonder why this is happening. A closer look at the numbers. Texas and California are two states that both have high numbers of deaths and very high disparities for Hispanic and Latino populations. In California alone, Hispanic people are 8.1 times more likely to live in areas where there is a high exposure risk than non-Hispanic white people. Latinos currently comprise 24.2% of COVID-19 cases in the United States, and overall 16.3% of COVID-19 deaths in the United States are among Latinos. I know this graph is a little blurry, but this graph shows the COVID-19 death rate in New Jersey by race and ethnicity. According to the graph, Hispanics have the highest death rate, followed by Blacks, whites, and Asian people coming in at last place. These numbers are surprising and sad to look at because it shows that something is happening that is making Latinos more susceptible to the virus. Why is this happening? This problem can be attributed to several potential causes. One reason might be Hispanic and Latino populations' increased work exposure during the pandemic. Working-age Latinos are more likely to die from COVID-19 than non-Hispanic white Americans in the same age group. This suggests that less Latinos are unable to work from home and they are in greater danger of contracting the virus if their jobs involve socializing with other people face-to-face. Another reason might be that Latinos often lack access to quality healthcare and are the least likely of any racial or ethnic group to visit the doctor when they are experiencing some sort of medical issue. Therefore, they suffer from poorer health conditions. How can we solve this problem? There might be no easy or simple solution in solving this issue that is affecting so many nationwide, but there are a few things that can be done to help alleviate this problem. For example, one way to protect communities that are experiencing an elevated risk of exposure is by prioritizing life-saving resources such as vaccinations, face masks, and other personal protective equipment or PPE at workplaces, schools, and events that involve social gatherings. Another important thing that can be done about this is to support projects and organizations that are committed in supporting healthcare for Hispanic and Latino populations around the world. Why I chose to write about this event. I chose to write about this event because COVID-19 is a virus that has affected countries all around the globe, and so many people already have a good understanding about this topic since the pandemic has been with us for the past 2 years. I also wanted to share information and statistics as to why this has negatively affected Latinx communities and the possible explanations as to why this is happening. And lastly, I wanted to share possible solutions as to how we can combat this virus and help make a difference in our communities and neighborhoods. These are the resources I used when doing my research for this presentation. And that is it. Thank you for watching.